Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what are the indications for spinal discectomy surgery for sciatica? Sciatica occurs in 1 to 2% of the population at any given point in time. Most people have no clue what they did as an inciting event. And what it is most commonly is slow disc degeneration over years that results in a tear of the outer part of the disc and the inner part squeezes out. It could be something very simple like a sneeze, or bending over to pick something up. It doesn't have to be something dramatic like a jet skiing accident or a car accident. The result may be a pinched nerve that gets inflamed and irritated and causes leg pain, possibly sensation of burning or pins and needles. Some numbness is possible, maybe some weakness, and rarely incontinence. That becomes a surgical emergency. Initial treatments should consist of a short period of bed rest. Recent research shows 48 hours or less is best. Over-the-counter medications may include anti-inflammatories and Tylenol. Physical therapy, chiropractic treatment, spinal decompression therapy has been an excellent treatment in over 80% of patients with intermittent computerized traction. Prescription medications may include a Medrol dose pack, possibly some narcotics, muscle relaxers, or neuropathic medications like Neurontin or Lyrica. There are several interventional treatment options. One is trigger point injections, which are great for relieving spasms and aching. Epidural injections, such as you see here, may include steroid being injected around the nerve root, and this provides a soothing bath of anti-inflammation that works really well for weeks to months. So the indications for sciatica surgery, there are 3 types of indications. One is an absolute, meaning you got to have it or there's going to be significant consequences. Second would be relative, meaning it should be definitely considered. And the third is quality of life, where you don't have to have it. It's more of an elective type of situation. Absolute would result from cauda equina syndrome. That's when a large disc herniation pushes on the cauda equina, which is the remnant of the spinal cord. So the spinal cord ends up here. This would be something like down here, okay? And that can cause a patient's problem with walking, with bowel or bladder function, and that needs to be operated on within 24 hours to help prevent long-term deficits. A relative indication would be motor weakness. If a nerve's getting pinched badly enough that you're getting some motor weakness, surgery should be considered. It's not mandatory. You can watch that motor weakness for a while, okay? Now, if the motor weakness is getting worse, surgery should definitely be considered. But if it starts to get better, you can continue to watch it. You just don't want to watch it too long. We don't know in black and white terms what watching too long means. It might be 12 weeks. It could be 6 weeks. There's a certain time frame where no matter how technically perfect the subsequent surgery is done, it's not going to get better. So keep that in mind. Elective would be if you've had over 6 weeks of conservative treatment for sciatica, including things like medications, PT, spinal decompression, injections. If all that is failing and the pain is not getting better, then surgery can be considered. Less than 10% will need surgery. Over 90% have good to excellent results if they do have surgery. There was a landmark study in 2006 showing that the outcomes at 1 year for those who had surgery versus those who didn't were identical. Okay? Surgery did help increase mobility and decrease pain faster, but if that can be controlled non-operatively, the outcomes were no different at a year. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state participating, accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. For treatment in the Austin area, visit us online today at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.